Let's talk about the dangers associated with advanced chronic skin ulcers in the elderly. The reason advanced chronic skin ulcers in elderly patients pose significant health risks is due to the combination of slower healing processes, potential underlying health conditions, and the increased vulnerability of aging skin. One of the most immediate and serious risks of chronic skin ulcers is the possibility of infections. Open wounds can serve as entry points for bacteria, leading to localized infections. If not properly managed, these infections can become severe, leading to cellulitis or, more dangerously, sepsis, which is a life-threatening response to infection that can result in multiple organ failure and, in some cases, even death. Elderly patients often have reduced regenerative capabilities due to advanced age, comorbidities such as diabetes or peripheral vascular disease, and possibly compromised nutritional status. These factors can significantly delay the healing process of ulcers, increasing the risk of complications as a result. And in cases where blood flow is significantly impaired, such as with severe vascular diseases, ulcers can lead to gangrene. This condition involves the death of body tissue due to a lack of blood supply and can necessitate amputation of the affected area to prevent the spread of infection. Amputations of any kind have been associated with poor outcomes overall and may range in a multitude of health issues, including depression and worsening of other pre-existing health conditions in some cases. Chronic ulcers can cause significant pain and discomfort, impacting the quality of life. Managing pain in elderly patients can be complex, especially considering potential interactions with other medications they may be taking and the risks some prescriptions pose themselves to worsening respiratory and mental status of many elderly patients when used to control significant pain. These significant side effects cause many doctors to not use strong medications outside of the hospital, resulting in inadequate treatment of pain outside of the hospital, and sometimes even when elderly patients are admitted to the hospital. The impact of mobility and quality of life can't be ignored. The presence of painful ulcers can reduce mobility due to discomfort or fear of exacerbating the wound. This decreased mobility can lead to further health declines, including muscle atrophy, increased risk of falls, clots, and social isolation, only compounding the overall impact on an elderly patient's quality of life and risk of further complications. Chronic ulcers, especially in elderly patients, may become resistant to conventional treatments. This resistance can lead to prolonged periods of care, increased healthcare costs, and significant caregiver burden. Given these risks, it's crucial for elderly patients with chronic skin ulcers to receive comprehensive care based on the most effective known treatments for advanced chronic wounds. This care should include not only wound management, but also attention to underlying conditions, nutritional support, and measures to prevent infection and promote healing. Interdisciplinary care teams, including physicians with expertise and experience in management of advanced chronic wounds, nurses, dietitians, and physical therapists, can offer the most effective management strategies for these complex cases. So if you know of anyone with a chronic wound and they're elderly, know that they are at increased risk of complications and get them help by an experienced professional as quick as possible. See you soon.